Thank you, Tracey, for having me. First of all, I just want to share something from Tia, who messaged me when Peter was talking. She said, "Love Peter poked fun at you with your running." So that was quite funny, and I laughed out loud. So again, thanks for having me, Tracey. First of all, I'm going to get you all active a little bit, and I want you to take your right hand out and just pat on your back. Well done, you, for looking more into your health. And then another activity is I'm going to ask you a few questions. Who feels you're busy all the time? Who feels you're stressed all the time? Who wants to lose weight? Who wants to sleep better? Who is doing breath work already? Oh, there's a few. And who wants to think clearer and perform better? Who wants to be fitter? Who wants to have better endurance? Who wants to run a marathon? Jared. Not me anymore. Who wants to walk 100 kilometers up mountain and on and down again? Nobody's here. Okay, I'm going to start. So just a brief introduction about me. I've got 2 boys, 2 dogs, and a husband who's Aussie, and we started Low Carb Melbourne together maybe 3 or 4 years ago now, and I founded Melbourne Low Carb Clinic about 18 months ago, and building up patient base. We talk about low carb, we talk about other lifestyle as well, and I've worked as a GP in Wantirna for 20 years almost. And I've done all this learning about low carb through Nutrition Network, Scope, Low Carb Down Under, bit of Acnum, and certified as a metabolic health practitioner. And then in Gold Coast, about last year, I went to Emma Martin's conference, and I was running along Gold Coast, beautiful, listening to Huberman, as I always do, and I was listening to breathing. And then there comes Jared, who was talking about breathing, and I went, oh my God, I'm going to learn about breathing. So I picked up Oxygen Advantage book, and I dived into breathing, and I learned more about breathing. I read about James Nestor, who is a journalist, and he talked about breathing, breath, which is the lost art. And I looked more into it and deep dived into it, and I'm so glad Dr. Shami put it on number 1 of her list on how to manage stress. So I looked into my patients, and there's so much more that I can help with my patients. Those people who suffer from coughs that lingered on for 2 or 3 weeks, I tell them, do you breathe through your mouth or do you breathe through your nose? And giving them just simple exercises that can help with their cough that lingered on after a viral infection. Some people with asthma, and giving them some breathing exercises can help them. And allergies and hay fever. Reduced inflammation. We've touched on inflammation quite a lot this morning with Peter and Dr. Shami. These exercises can reduce inflammation. It's another tool that can help you with your lifestyle. It'll reduce your inflammation, reduce your risk of heart attacks, cancer, which is all linked to metabolic diseases. Then I'm going to talk about religion. There's a lot of religions throughout history that actually incorporates slow breathing into their practice. Like we know the Buddhists go, Om. That actually slows down your breathing, and it improves vagal tone, and it helps you breathe slowly and consciously. Hindus do pranayama and yogic breathing, and they incorporate all this breathing into their religion as well. Tai Chi and Qigong also incorporates this breathing into their slow breathing. And breathing can be your religion, and you can believe in your breathing, and this breathing will be your religion following you till the end of your life, until your last breath. It would be your own religion. So you can believe in your religion. So all these lifestyle pillars that we've talked about, stress, nutrition, sunlight, and having an active lifestyle, breathing is just another tool that you can use to improve your lifestyle, reduce inflammation, improve on your stress. And we're going to go into how we can use breathing to do work. So nose breathing or mouth breathing? Who thinks mouth breathing is better? Nobody. Who thinks nose breathing is better? So you're all right. So we should all breathe through your nose. Do you know what your respiratory rate is? So we're going to do a quick exercise, just 30 seconds. And we're going to just breathe normally, and we're going to count how many breaths you take. Starting now. 3, 2, 1, stop. Do you know how many breaths you took in that 30 seconds? So multiply that by 2, and now you know how many breaths you take. And then we're gonna, someone want to tell me how many breaths you take? 10, 5, 8, 4. That's very slow. 16, there you go. So I just looked at mine this morning. Mine's about 13 overnight. The ideal is less is better. So we should aim to be less. 5 is great. What if we're breathing too much? Now we know if we eat too much, we get fat. If we do intermittent fasting and eat the good foods, then we improve our health. If we breathe too much, we actually get a lot of problems like hyperventilation. Hyperventilation symptoms, you get palpitations, you get irritable, you feel faint, you get headaches, and you breathe too much, you actually feel more short of breath, and you can get a cough, chest tightness, and you can feel anxious, panicky, allergies. You can even get difficulty swallowing, you feel dry mouth, dry throat, even heartburn, flatulence, so passing wind, you feel weak, exhausted, impaired concentration, impaired memory, poor sleep, poor performance, and you get more emotional. So functional breathing and dysfunctional breathing. Dysfunctional breathing means you're not breathing properly. Functional breathing means you're good. So slow breaths, 8 to 12 per minute is functional. Slowing down and make you silent, quiet, invisible at rest through your nose and into the abdomen, into the diaphragm is functional breathing. It's so common. The prevalence of dysfunctional breathing is 10 to 30% in adults, depending on the study you find. And dysfunctional breathing is often related to asthma, chronic obstructive airways disease, anxiety, panic, chronic pain disorders. These people have higher chance of dysfunctional breathing. And in children, different studies showing that it ranges from 5 to 33% of children can have dysfunctional breathing. Dysfunctional breathing can cause them to have asthma, anxiety, ADHD. All these children have higher chances of dysfunctional breathing, and it can really affect the child's quality of life, might affect their school performance, they might not sleep well, They might have frequent respiratory infections, frequent colds. And I do see these kids coming in to see me because they get colds very often. And I see them breathing through their mouth, they're snotty, they're blocked nose, they have lingering coughs and colds, and maybe the childcare infections that we're blaming because of the childcare. Maybe it's because that they're breathing through their mouth too often. What causes dysfunctional breathing? There's the processed food and overeating again. So the modern society can increase the risk of dysfunctional breathing because the food's not right and they're not exercising. They might be, so talking too much can cause dysfunctional breathing as well. Stress. So sometimes if you're stressed, you're not paying attention to your breathing and you're breathing too much because you're breathing too fast. Sometimes people will tell you it's good to take a big breath and you breathe through in and out through your mouth. And even if you go exercise, if you go on a bike class, the trainer might tell you breathe in and out through your mouth. And that's actually a misconception that you should be breathing through your mouth and breathing big breaths. Warm houses can make you have dysfunctional breathing, having asthma, and it certainly can run in the family. You should never breathe through your mouth. Not never, but as much as you can, concentrate on breathing through your nose. And that includes when you're awake, when you're exercising, and when you're sleeping. So some people don't know that they're sleeping and breathing through their mouth, and then we can go into that a bit more. And exercising, the more you train breathing through your nose, the more you will get used to breathing through your nose, and that can improve your exercise endurance. So the benefits of breathing through your nose, there's so many benefits. It actually increases your oxygen uptake, and we'll go into that a bit more. It produces this magic gas called nitric oxide. During the COVID pandemic, there was actually studies trying to get this nitric oxide, and it's believed to have antibacterial activities. And the scientist was actually trying to develop nose sprays on how we can spray nitric oxide and have reducing COVID morbidity. So there's actually science to breathing through your nose. Breathing through your nose and breath holding exercises actually increases nitric oxide, this magic gas in your nasal cavity. And it's actually a vasodilator. It opens up blood vessels, and that might reduce your blood pressure. And it calms and soothes your body, improves oxygen going to the lungs. So it's magic. Oops. Children breathing through their mouth, they actually don't sleep that well. Back in the olden days, when they're living in tribes, some of the mums actually close the baby's mouth when they sleep, and that helps the baby sleeping. And breathing through your mouth as a child actually causes poor facial development. Combined with soft food and not chewing properly, the kids nowadays have much higher chance of getting braces and orthodontic treatment. So not breathing through your nose and breathing through your mouth causes facial deformities of receding jaw, and they don't look as pretty, these children. So there's lots of consequences. I'm just going to tell a story of a basketball kid. My child's 12-year-old does basketball. And another child, I keep hearing him opening his mouth and they're playing basketball, and I see him breathing through his mouth all the time. And I just feel so much urge to tell the mum, but of course I can't. I'm not a doctor, and this is my child's basketball teammate. And then I spent some time with this child. He's got hay fever, he's got blocked nose all the time, he's got nosebleeds, but I can't tell the mum, unfortunately. So, but I can tell my patients. So the more I learn about this, the more I ask the patients, Is your child breathing through your mouth or breathing through the nose? So the benefits of improving your breathing, we can lose weight. So isn't that good? We can reduce our stress, we can improve our concentration, improve asthma, reduce anxiety, improve our energy. We can improve our exercise tolerance. We can improve our circulation, maybe reduce our blood pressure, warm the air, reduce irritation in the throat, and maybe you won't be coughing as long after a cold. Maybe we can improve our water balance. We're not dehydrating as much, and we can improve our sleep, improve our smell and taste, improve our posture and spinal stabilization. Functional breathing improves functional performance and our muscles. So we've gone through this quite a few times. Jared's talked about it. Dr. Shami's talked about it. Doing breathing exercises improve our vagal tone. And again, it's a breath myth that breathing too much, breathing more, taking big breaths, it's a myth. So we should really work on less is more. Reducing our breath increases our carbon dioxide and actually increases our oxygen absorption. So we've gone through this. Which gas is more important in regulating our breath? Who thinks breathing more will get more oxygen into our system? I think we all know by now, carbon dioxide is the key. So when we take pulse oximeter, when we go to emergency, most of the normal people, you get 99% of oxygen in our pulse oximeter. You can't get more oxygen. Breathing more doesn't get more oxygen. Whereas if we breathe better, we can actually regulate our carbon dioxide, and in turn, we get more oxygen into our body system, our body muscles and tissues. Just a tiny bit of science on a little bit of physiology. When the oxygen goes into your blood, it goes into the hemoglobin, and the hemoglobin is in the red blood cell and it binds to the oxygen that is coming into the air. If your blood becomes a little bit more acidic by increasing your carbon dioxide, then the more acidic environment that you're in, your oxygen actually is better to be released from the hemoglobin into your muscle, into your brain, and that helps to get more oxygen into your muscles and brain. So we do this by increasing our carbon dioxide, not by breathing more. So we can do this by measuring our BOLT score. How are we going with time? We're good? So I'm going to get you to measure your BOLT score together. What we'll do is I'll get you to get your phone out. Everyone get your phone out. Okay. And we're going to get the timer out and we're going to go to the stopwatch. We're going to measure your BOLT score. So how we measure our BOLT score, I'm just going to talk about this first. The BOLT score is the time that you measure after taking normal breaths. So we're going to take a few normal breaths in and out. We're going to start together, and then you're going to start your stopwatch on your phone. And the first sensation you feel like you've got to hold your breath. So you're going to hold your breath after a normal breath in, breath out. And then the first sensation you feel like you want to take a breath, then you stop your stopwatch. So this is not not holding your breath as long as you can. This is the first sensation you want to take a breath. So we're going to start, you're going to take your breath in and out. Just take some normal breath in, normal breath out. And on the breathing out, we're going to start now. You hold your breath. And we're all holding. When you feel like you need to take your breath, then you press your stop. So if you feel like you need to take a breath now, you stop now. Somebody still holding? Somebody still holding? No, no more. So that's about 42 seconds. Oh, you're still holding? No, no. Anyone want to share what scores did you get? 33? 30. Well done. 38. Well done, Nellam. 51. Well done. So well done to those who are over 25 seconds. You most likely don't have dysfunctional breathing. And those of you who are under 25, you probably have dysfunctional breathing. So there's actually so prevalent that about 30% of people have dysfunctional breathing. I tested on a patient who had long COVID maybe last week, and I tested her in the clinic and we did it together, and she had 6. So after 6 seconds, she wanted to breathe already. So what we've got to do is we've got to regulate our biochemistry. What I mean by that is we've got to practice doing these exercises so you can be more tolerant to carbon dioxide. So then you don't feel like you need to take a big breath straight away. Then our body can get used to higher carbon dioxide levels. Then we can improve our BOLT score, and you can measure your BOLT score at home just doing this. You can measure in the morning, try and do it in the same condition, and then you can improve. So the aim is we want it ideally less over 25, and 40 is what we should aim for. So when I started doing this last year, I was 28, and now I'm about 33. So that's my story. Well, how to do this? We want to do LSD. We want to breathe light and breathe slow and breathe deep. So there's 3 dimensions to it. Breathing light will improve your carbon dioxide level, and breathing slowly and deeply into our diaphragm. So just be careful if you're pregnant, especially in the first trimester. If you have anxiety, panic disorders, sometimes it can set you off if you're doing longer, slower breath holding exercises. If you have uncontrolled hypertension, obstructive sleep apnea, or severe cardiovascular disease. So another exercise is we're going to try to learn how to breathe light to breathe right. So what we try to do is so some people breathe big amplitudes. So we try to reduce the amplitudes in our breathing. That can help to reduce the air that we're going in and get your body to tolerate carbon dioxide more. So what I'll try to get you to do is we're going to sit up straight. We're just going to do this for 1 minute. And make yourself comfortable. Imagine there's a string pulling you up into the ceiling, and put your finger underneath your nose, close your eyes, and imagine you're breathing very, very light, that you can't even feel any breath in and out through your nose. Your finger can't feel your breathing because it's so light that your nose hair isn't even moving. And you can get lighter and lighter that your finger doesn't even feel it. Okay, that's great. So you can practice this at home, doing this for 5 minutes or 10 minutes, however longer you do. Slow breathing, some of you did it with Jared yesterday, so you can increase your breathing to longer and longer. So if you're not very good at your Bolt score, you can start with 3 counts in and 3 counts out. Then you can increase it to 5 counts in, 5 counts out. Then you can even increase it to 7 counts in, 7 counts out, and can slowly learn to breathe slower. Diaphragmatic breathing. So Dr. Shami said, breathe deep. What we can do is we can all get your hand to hold it into the lower rib cage, and you can practice feeling your breath. When you breathe in, your rib cage goes out and your diaphragm will go down. And when you breathe in, then when you breathe out, then your diaphragm will go in and your rib cage will go in. So then that can optimize our breathing into our diaphragm, into the whole lung, not upper chest. So when you breathe into your nose, quite often it'll breathe into the diaphragm. If you breathe through your mouth, you go upper chest. So that's not the correct way. We can practice box breathing, which is used a lot in the Navy SEALs to regulate their nervous system, calm them down. You can try 4 seconds in and hold for 4 seconds and out for 4 seconds and hold for 4 seconds. When you get better at it, you can do 5 seconds, you can do 6 seconds, and that can improve your vagal tone. There's other box breathing variations like in for 4, hold for 4, out for 6, and hold for 2. Or you can not box and just do in for 3, out for whatever you like, 6 or 9. And 4, 7, 8 is a very common box breathing variation. In for 4, hold for 7, and out for 8. And you can practice all these things. Then there's other breathing exercises, like when you go out for a walk, you can do some breath holding exercises. I started doing walking, and then I hold for 10, and then so 10 walks, 10 steps, I hold it, and then I release and then breathe normally for 10 steps. And then if you get better at it, you can do 20 steps, breath hold, and then you can breathe normally for 20 steps, and then you repeat it 5 or 6 times. And you can incorporate it into your walking. You can go for a run, and then after running, you can incorporate into your exercise. So you can do all this in your everyday life. You can practice breathing slowly, deeply, and lightly when you're doing anything, even when you're driving. And you can incorporate it into your day-to-day activities. You can go running, and you can do some nose breathing even when you're running. So when I run a very fast park run, I usually would do nose breathing for the first kilometre, then after that, mouth breathing, because it's getting more vigorous. And it's okay, and you can just progress however you like. There's no fixed rule to it. And just to let you know that you can actually wear a face mask like that, and you can practice face mask and exercising at the same time. I'm not asking you anyone to do it, and I'm not doing it myself. And that can improve your carbon dioxide tolerance. Again, mouth taping, especially for those of you who feel dry mouth, then maybe mouth taping will help you sleep. If you don't know if you're breathing through your nose or mouth at night, you can just try your mouth tape. I just use a very cheap micropore tape, which I just grabbed from the clinic. Or you can get all sorts of tapes. I looked at Amazon, there's lots of different variations of mouth tape. This Myo tape has a slit in the middle, and then you don't have to worry about suffocating. Not that you will. Breathing properly helps you sleep. If you sleep properly, your mind functions better. If your mind functions better, you breathe better. And it all works together, and it's another tool together with your eating well, exercise, sunlight. So I've used all these apps. They are all free. Resonant Breathing, you can set the amount of breaths and you can train with Resonant Breathing. Oxygen Advantage has another free app. You can measure your BOLT score. And there's all sorts of lessons and exercises with Oxygen Advantage. And Insight Timer has got all sorts of meditation and breathing exercises. I've used it for free for many years and now I paid for it because I like to support these things. And last month I had a 10-day Breathe Together with Me challenge, and I've just put it in my website as a course. You can buy it now for $49 with a talk and 10 days of breathing exercises that I've incorporated. You can join my membership program, which has got lots and lots of talks, and we Zoom each other every 2 weeks as accountability. We talk about low carb. Last time we talked about cholesterol, all sorts of topics. And it's a great group which is building. That's Understanding Cholesterol, which is just a few days ago, and I've got online courses which you can go to my website and find. And you can find me in Montana or interstate telehealth. Thank you for having me.
Thank you, Amy. Gosh, after this weekend, you're all going to be exceptional breathers. So excellent to have the understanding and all the science behind it. Did anyone have any questions for Amy?
Just questions on why you've got a stuffy nose. How does the scientific get past that with the nose breathing?
Yeah, yes.
Can you ask the question into the mic? Just
Yep. So the question is, if you have a stuffy nose, how do you incorporate breathing? So the answer is the more you use your nose, the less stuffy you can get. The more you don't use your nose, the more your nose will get more stuffy. So the more you practice, the more your nose will unblock. And you can actually do nose unblocking exercises to help unblock your nose. And I've taught my 12-year-old and he said, oh yeah, that worked. But he didn't do it enough. So what happens, what you can do is you can do some breath holding. So you block your nose, move your body, and then hold as long as you can. And then when you feel like you need to take a breath, then you unblock and breathe through your nose. And then you might need to repeat this 5 or 6 times, and that might unblock it for that moment. But maybe an hour later, you might need to do that again. And then each time you do, the more you do it, the more you will unblock your nose.
With the saline, like Dr. Barton was saying,
Yeah.
that he recommends the saline spray every night before bed. Would that help?
Yeah, that'll help as well. Yeah.
Hang on, Zee. There was another question. Casey.
Just going back to breathing mouth breathing. How do I get into the habit of having such responsibility? That would be me. I'm a lot better now, and having been around for years are there. But I'm just wondering how it would come about in the first place. So we don't follow.
Again, the processed foods and the sugars might have contributed to it. The not chewing might have contributed to it. So our food isn't as chewing anymore, and we're feeding them rice cereals back in when they're little. And maybe you're not reminding them. The more we remind them, the more they will breathe through the nose. And the warm houses can make them breathe through the mouth more. And it's habits, or could be genetics. So we should try and remind them as much as you can. And or you can do the games with them, that you can get them to hold the breath and get them to walk or run. If you look at Buteyko breathing on YouTube, they've got all sorts of exercises and YouTube videos for children, and it's actually free. So there's lots of children exercises on the Buteyko YouTube channel that you can do it together. Or you can do games with them, get them to hold their breath and run from there to there and then run back again as much as you can.